to Coronavirus The Rundown. I'm Chris Stewart. Each day we showcase how American communities are taking on coronavirus and working to find normalcy during this time. Alicia Nieves is looking at recovery in the U.S., what it might look like.
When thinking about how the American economy will recover, many turn to letters for answers. Usually the letters V, U, or L. V stands for V-shaped recovery, a best-case scenario in which our economy comes out of this sharp downturn with businesses opening and everyone quickly going back to work, essentially an equally sharp bounce back. In a U-shaped recovery, the economy, including the labor market, rebounds just a little bit slower. L is the dreaded recovery scenario. It would mean we would linger in this downturn for quite a while, just barely crawling out of it after a long period of time.
A lot of people are scared.
A few weeks ago, we spoke to a group of economists and financial experts. Most said then they felt the U.S. would see a quick rebound, a V-shaped recovery.
If everyone is really good about doing what needs to be done for this health crisis and it's shorter in nature, it could be just coming back into things as usual.
We could turn this around this year, I think. I still think there is real hope for that.
But a lot has changed since March.
I don't think that anymore.
Todd McCracken is amongst those who now believe it will take the U.S. slightly longer to get jobs back, restore markets, and recover.
I think the realization most of us are in is that even when this turns, it's not going to turn uniformly across the country. And so even if I, as a business owner, am ready to do business again in my area, we flatten the curve, we reduce the curve, and we're opening back up again, it doesn't follow that my vendors and my customers and my supply chain are in the same spot.
McCracken thinks we are more likely now to see a U-shaped recovery, and many experts agree. In fact, in a recent Reuters poll of 50 economists, half of the respondents predict a U-shaped recovery, with only a few experts pointing to some less likely and unusual recovery shapes for unusual times.
I think that it might be a short V followed by a longer slant. Some people are calling this the sort of square root recovery. I think we'll see some activity really bounce back because there's a lot of pent-up demand for a lot of activities that people are unable to do while they're social distancing. But at the same time, a lot of sectors will have structural adjustments made that will just take some time.
Regardless of whether we see a traditional recovery trajectory or one of these new patterns that some experts are predicting, the key here is that almost all experts agree the U.S. economy will recover, and so will we. I'm Alicia Nieves reporting.
Alicia, thank you. The Army is learning more about how coronavirus lives and about ways to kill it. Top Homeland Security leader Bill Bryan says new Army studies found sunlight appears to be powerful in killing the virus. He says the virus does well inside and in low humidity environments. The Army studies found bleach can kill the virus in about 5 minutes. Isopropyl alcohol can kill it in 30 seconds. Bryan says the findings will help future decisions. He does warn it's irresponsible to say the summer sun will totally kill the virus. The presentation sparked speculation about whether doctors can use UV light or disinfectants to treat the virus in humans. The FDA is warning against both. The FDA's director says do not ingest any disinfectants ever. The makers of Lysol also put out a warning saying nobody should ever consume any of its cleaning products. Doctors warn sun exposure will not protect people from the virus. Exposure to UV light can cause other issues like sunburn, skin cancer, among other problems. Well, many people are trying to stretch their money right now, and our partners at Newsy asked the experts if we should cancel subscription services.
You want to consider looking at subscription services, anything that is not an actual need, getting either suspended, temporarily paused, or completely cut from your budget right now in order to preserve cash.
In my view, mental health is equally important as physical health. Now, you just cannot switch off Netflix. You just cannot switch off your television because that keeps you informed. So you have to keep some basic subscriptions. One thing that I would recommend people is maybe embrace radio. So there are a lot of free radio stations on the internet, and which gives high quality information. They're entertaining.
Maybe you're in a high risk category and you can't physically be going into a grocery store. It's too big of a risk. Then sure, it makes sense to continue to get, whether it's a food delivery service, whether it's ordering your groceries online, even if that costs a little more.
We do still have to consider
consider our quality of life. And if it's going to help keep your kids in the house instead of having them outside where they could get sick, then that might actually be an essential expense.
Now, as things start to go back towards normal, the National Safety Council is working with the government and companies to create a guide so they know how to protect workers.
The resources, the playbooks, the instructions, the policies that companies can put in place very quickly and easily to support whatever their operation might be. So that's everywhere from transportation to farming to retail to restaurants to manufacturing. Every environment there is a little bit different, and the safety protocols you're going to want to put in place are going to be tailored to those environments.
NASA, McDonald's, and Walgreens have already put together safety plans. The National Safety Council is looking at those to help companies with fewer resources. Moves to help maintain physical distancing in the office could include different types of work shifts and doing more cleaning. Testing will be a huge factor. The National Safety Council and 50 organizations sent a letter to the White House calling for workplace access to testing. It also wants more focus on mental health and substance abuse. A group of friends had an idea to gather digital thank you cards for healthcare workers. As Rebecca Thornburg shows us, that idea really took off.
To all the frontline workers,
thank you for saving so many lives.
4 friends, Noah Friedman, Sahil Baiwala, and Williamsville natives Ben and Ariella Sharf created the website 6 Feet Closer. In just 3 weeks and 500 videos later, 6 Feet Closer has become the digital version of a thank you card.
Thank you.
We are so grateful
for all of your hard work over the last couple of weeks.
This too shall pass, and focusing on good and good energy and providing hope, connecting with people is one of the most powerful anchors to get us through it.
6 Feet Closer allows you to make your own thank you video.
Thank you so much for showing up to work every single day
and will be sent to a frontline worker anywhere in the country. You can also nominate a nurse, doctor, firefighter, police officer, grocery store clerk, or any essential worker to receive an uplifting message.
We feel there's something very powerful about not knowing the person who's sending you the thank you video. We think that this gratitude is much more genuine when it's being able to know that someone across the country.
Great stuff there. And Rebecca, thank you. Now, pets have tested positive for coronavirus, but experts are tempering concerns.
We still have absolutely no evidence that dogs and cats can spread the virus back to people.
We ask if pet parents should take the same precautions with their animals. And the American Red Cross now leading a program to test plasma treatments for coronavirus patients. What doctors say is needed to tell if that works. Just this week, the U.S. had its first 2 cases of pets testing positive for coronavirus. They were 2 cats who live in separate areas of New York State. The CDC says the pets are expected to be okay, and it's putting in some guidelines as to how to protect our pets now. The CDC says don't allow animals to interact with people or other animals outside the household. Try to keep cats indoors if possible. Avoid dog parks and other public places where animals and people gather. Now, if you're walking your dog, maintain at least 6 feet of distance from others. The CDC and animal experts agree there is no evidence that pets can spread coronavirus.
Just because dogs and cats can get infected, it doesn't mean that they can shed enough virus to infect people or shed virus in a way that promotes transmission to people.
Dr. Jane Sykes says those who should make the biggest routine changes are families who may have been exposed to coronavirus or have compromised immune systems. They should try to minimize contact with their pets and consider having someone else take care of them. Pet owners should wash their hands frequently, including after interacting with a pet. Dr. Sykes also says this is not a reason to isolate from your dog or cat.
People should actually enjoy their animals at this time instead of being afraid of them as a source of SARS coronavirus 2. They should enjoy all the things that the human-animal bond brings at this time, especially at a stressful time, when people are feeling isolated, they might be stressed about their work.
Now, Dr. Sykes says human-to-human interaction is the biggest worry. We should try to avoid coming into contact with animals that don't belong to us. The American Red Cross is testing a treatment that uses plasma from recovered patients. The organization telling Kai Beach why it thinks the treatment is important.
there's no standard way, I guess, of like reacting to a positive COVID-19 test. At first, obviously, I was like pretty scared.
College student Nico Obide turned his fear of contracting COVID-19 into a way to help fight this global pandemic.
The donation center to donate was a great experience, really humbling. I mean, people were really grateful that I went in to donate.
After fully recovering from the symptoms, Ubide decided to donate his plasma. Medical researchers will use it for experimental antibody treatments for coronavirus patients.
It was a really rewarding experience. It took 45 minutes. And it's honestly just one of the best ways to do your part in this whole situation.
This medical approach is called convalescent plasma therapy. It's too early to tell if these plasma donations have an impact on COVID-19, but experts say it's been effective before against other viruses.
This is something that I think we need to do as Americans for our neighbors.
Aaron Goodhue is with the American Red Cross, the organization spearheading this program. Despite the uncertainty of this procedure,
would you like a blanket?
She says it's well worth the investment.
Regardless of hospital affiliation, we feel this is a person-specific therapy, and we want to make sure everybody who needs it can get it.
That's why the Red Cross is now partnering with specialists at places like MedStar Georgetown University Hospital.
We're also amazed and really worried about how rapidly those individuals who don't do well with their infections deteriorate.
Dr. Craig Kessler supports this plasma therapy, saying as more people die from COVID-19, there's now a growing need for more plasma donors.
Only with community participation will we ever learn whether this is a valid approach to the treatment of a very serious and high mortality disease.
To find out if you're eligible to be a donor, visit redcrossblood.org. I'm Kai Beach reporting.
Kai, thank you. And each day, healthcare workers are risking their own well-being to care for coronavirus patients. For undocumented immigrants allowed to work as medical professionals, a challenge to their legal status looms like a ticking time bomb. So more deportation could take out a large part of the workforce during this pandemic. And Usher Qureshi spoke with a frontline doctor who has lived with that uncertainty all his life.
These days, Ever Arias is on the front lines. Working 12-hour shifts, he's a second-year internal medicine resident in Southern California, dealing with coronavirus patients.
I mean, I haven't really been practicing for that long, but in my short time doing my residency, I haven't seen anything like this.
2 years ago, Arias was amongst the first undocumented students to become physicians in the U.S.
We came from a background of nothing. My dad was a farmer. My mom worked at home cleaning houses.
An executive order from President Obama called Deferred Action for Childhood Arrivals, or DACA, granted temporary protection to 700,000 undocumented immigrants brought to the U.S. as children. The status allowed Arias to attend medical school and work.
We have 15 of these doctors in residency training, treating patients during this COVID-19 pandemic, some in emergency rooms, some in internal medicine, family medicine, putting their lives on the line.
An estimated 27,000 DACA recipients are working as doctors, nurses, physician assistants, and support staff in the healthcare industry across the country. The Trump administration's 2017 repeal of the program has sparked a legal battle over DACA. The White House contends the program should be addressed through legislation. The Supreme Court is now looking at the case with a decision expected in the coming weeks, something DACA advocates say could put thousands of frontline workers at risk for deportation.
These young people are being asked to put that out of their mind and go put their lives on the line and serve others.
On Monday, the High Court agreed to consider a new filing, arguing that, quote, termination of DACA during this national emergency would be catastrophic. Asked earlier this month about whether the White House would protect DACA healthcare workers due to the pandemic, the vice president would not say.
Well, I think the president's been very clear on his desire to reach a solution on that issue with the Congress.
Arias, fortunate to have received his green card this past fall, says there is still fear.
I still have family members and brothers and loved ones, friends who are still in that category, and I fear for them.
Reporting from Chicago, I'm Usher Qureshi.
Usher, thank you. And coronavirus is having some unexpected impacts. We are taking a look at some of the main ones, from pollution to rat populations to empty animal shelters.
And we won't stay quiet.
Welcome back. From air pollution to trash to rats, coronavirus is having an unexpected impact on the world around us. Andrew Ramos is looking at those.
From a drop in pollution to less congestion on the roads, New York City has reaped unlikely benefits in the face of the pandemic. Stay-at-home orders have not only transformed a one bustling city, but has put a dent into air pollution by 25%. It's a trend happening all over the world. These are satellite images over India before and after the countrywide lockdown.
We need to see this as a bit of a dry run.
New York City's chief climate policy advisor, Dan Zarelli, says while the benefits may be short-lived, it's action that should continue.
What it really shows is that the types of things we need to do, the scale of impact, the collective action that's necessary to achieve big reductions like that.
Trash has also been on the decline. The Department of Sanitation reports a 7% drop in trash collection, with restaurants no longer in full operation. Less food and scraps are left on sidewalks, and that has sparked a drop in the rat population in a number of neighborhoods. Meanwhile, animal shelters across the country are thriving, seeing a surge in adoptions and fostering. This dog kennel in Palm Beach County, Florida, emptied for the first time in its history. Here at home, St. Hubert's Animal Welfare Center in Madison have placed nearly 400 animals in foster homes. This after receiving nearly 1,000 applications to foster.
How does it feel knowing that this is a phenomenon, this is a growing trend across the country?
It makes me optimistic about human nature. It's very, heartwarming.
While the pandemic has wreaked havoc in communities around the world, conservationists believe it should serve as a wake-up call.
So if this sickness in your bodies opens your eyes to the deeper sickness in our shared planet, it will be to all our benefit.
The Global Wildlife Conservation rolled out their new campaign, #Extinction Ends Here, taking humankind to task.
If we want to sort of pass on a livable, healthy planet, I think that the bottom line is healthy planet, healthy people.
Andrew, thank you. And a neighborhood is helping a woman help others. The growing giveaway and what the organizer says has been surprising.
Sticking together while staying apart.
Each day, as we end the rundown, we want you to focus on the positive that is happening right now during what can be such a stressful time. And today, we go to San Diego. A woman whose offer to help a neighbor really just snowballed. Eleanor Jacobs is a realtor. She offered $50 gift cards to 10 neighbors who are now out of work.
Between the number of people who needed help and then the number of people who were offering help, I just started to cry. I thought it's a tough world, but it's also, there's a lot of people who, even if they don't have a lot, are willing to offer it to somebody else. My dad used to say that anybody can be nice when things are going well, but when things are tough is when you really see what a person's made out of. And so we're just seeing that there's a lot of people in our community who are made of some really good stuff.
Yeah, the good stuff here is the pool of money has more than tripled at this point. Neighbors now pitching in to help. Great stuff. And that's all the time we have today for Coronavirus The Rundown. We'll see you next time. I'm Chris Stewart. Thanks for joining us.